So side effects and risks is something I'm really worried about. I think as a nurse, we're just worried that we're going to hurt someone. How do you warn someone about the risk of a VO, the risk of swelling and bruising without scaring them off? Because I think whenever I say that to someone, I think, how are they still trusting me to inject them when I've just told them these massive risks that could really impact their lives? How do you say that without making someone run for the door?
So there's definitely a skill in this, and people go one of two ways in the beginning. They either downplay it and don't give them enough information because they're worried, which is very risky, because if you do have a problem, then the patient feels there's an injustice. And that this is why you get sued, is because the patient, they will routinely come back and say, I would never have had this treatment if I knew this could happen. And of course, that's not true, because if you tell them they all have the procedure, what they really mean is, I didn't have the chance to avoid this. And that feels like an injustice. And that can be as simple as a bruise. That's big. That's quite a big bruise. The trick is it's that story structure again. You tell them the truth, but not just the bad sides. Like, it's not just, you might get a blocked artery which could blind you, anaphylaxis and death.
Yeah, that's what I'm scared of.
And that's what the other side of thing people do. People do this on training courses. I find it quite funny, to be honest. I'll say, you guys practice consenting.
Yeah, and that's what we did on our foundation course. I go, yeah, you might have an allergic reaction, you might have vascular occlusion, and there's a theoretical risk that you can have a stroke. Like, why would someone ever want treatment?
Yeah, and they're terrified. So it's the leaving them hanging them. If you think of it from a story structure, that's the maximum conflict of the moment, which is, now I've just told you all the bad things that can happen. Now you need to tell them the rest of the story, which is, what are the likelihood of those things? And ideally, like, what can you compare that with? So I know that your chance of getting in a car accident that causes a significant injury is about 1 in 17,000. So you could say you will still drive every day, and that is actually less likely to be injured in terms of blindness, for sure, than be in a serious car accident. But we all so that helps them put it into some perspective. So you can help them get the scale right, because this is another thing with the human brain. Without scale, it sometimes just maximizes it. And I think even injectors do this. So they talk about, for example, non-surgical rhinoplasty is the riskiest place to inject. So without a scale of exactly what that risk is, people just take it off the list as if it's an absolute
not worth it, yeah.
But actually the chances are still low, and you can even lower it further by doing certain things. And that's the next thing I'd build into the consent process, which is, although there are these risks, I'm doing a number of additional steps to try and reduce that risk. And then it's really good now to actually teach them what you know about it. So eyelid-ptosis in the published data says a 1 in 100 chance of causing an eyelid to drop. That's not the experience. You can say that's not the experience of my trainer who's taught me a specific technique to lower that risk. And what I'll be doing as I'm injecting is putting some pressure on the orbit to stop Botox flowing in that direction. I'll also be injecting at the right depths. So I'll be injecting deeper in the middle, but much more superficial as we get closer to the eyelid, which means there are multiple layers of tissue that will defend that muscle from being affected by the Botox. And using this technique, I can tell you that my trainers had 1 injection in 10 years that caused a very slight eyelid-ptosis that actually didn't need treatment. So you can tell that kind of story with it. So you're not just saying there's a risk of your eyelid dropping, you're saying, but there are things I do to prevent it, and it's unlikely. And then it's okay to, at the end of that process, you do the same with the vascular occlusion. So the published data, depending on which paper you read, I used to say 1 in 15,000. I found a paper that's pretty good. That's 1 in 6,000. You can then say 1 in 6,000 mils causes a vascular occlusion. Most of those are treated on the day and don't leave scarring. But that's the thing we worry about. That's why you need to understand it, so you can come back and seek help. But I will also check you before you leave. So before you leave today, I'll check capillary refill, make sure that the blood flow is normal. If I was to detect an abnormality, I would dissolve it with this product that I have in my drawer.
I've got it here. I know how to use it.
Yeah. Hyaluron-Daze, you inject it, you massage the vessel. It can take sometimes 45 minutes, sometimes several hours, depending on the type of filler and where it is. And I also have the backup of the people I've trained with who can advise over the phone, things like that.
Yeah.
And if I follow all that process, the chance of someone getting a scar who's diagnosed immediately is vastly lower than the ones who come back 2 days later. Those are the ones I worry about. Big bolus, falsely reassured over the phone, goes on for longer. Eventually they come back 3 days in. You can't really help them that much. So immediate diagnosis with a prepared clinician, with a small VO, it's actually pretty routine. Like, you're not going to have that many problems doing that. So you just have to inject in a way that causes, if you're going to get a VO, it's small. If you're going to get one, you diagnose it immediately, and that you're always prepared for it, and you're massively in a safer camp. So I basically teach them that. And the more questions they ask you, the better. And in the beginning, it'll be clunky because you haven't been asked all these questions, but research it, write a little mini paragraph in response. And eventually you become the person who brings certainty to the uncertainty. So you do also bring the uncertainty because you say, did you know you could go blind and cause a stroke? Well, there are lots of ways I do things to prevent that. So stroke, for example, you can explain that you need to put a huge volume in. I don't think may have happened once with an HA, but you typically are putting 5 mils of fat in a surgical procedure before what's called a filler causes a stroke. So we're not using anywhere near that volume. Even if I was to directly inject the artery with the amount I'm going to put in, it would never cause a stroke because it's not enough to get all the way down that vessel. So you can tell them that stuff. But I don't just rely on volume. I also know about the depth. I also going to aspirate before my treatment, which will give me some percentage chance of detecting.
Yeah, if it reduces the risk. Yeah.
So by the time they've heard you go through all the things that you do to make the risk safer, compared with the person down the road who just waved the form in front of them.
Read this, and sign that, yeah.
Although it feels a bit scary because you're directly talking about these things, what they get is the opposite. They're like, this person actually knows what they're talking about. It's actually a huge reason why people ended up having bigger procedures with me, is I got so good at the confident delivery and breaking down of information that by the end of it, they're like, well, if I'm going to have it, this is the place to have it. I might as well come here,
yeah, you're here, you know what you're doing, you're keeping me safe.
And the patients who don't care about that are not a great patient base to build your practice. If they only care about the price, they're not interested in the technical details, they just want to have it quickly done, they're actually not a great patient base. And no disrespect to them, we're all different, but you want patients who value the safety, who value your time, who value your expertise, and will stick with you because of those things, not someone who just wants it a little bit cheaper.
Yeah. Well, you're more than just a mill, aren't you?
Yeah.
Yeah.